According to recent statistics, millions of Americans are living with some form of chronic pain. Lower back pain is the second most common reason patients visit their doctor, while chronic headaches affect up to 1 in 20 Americans. Overdiagnosed and poorly treated fibromyalgia is another chronic pain condition that is quickly becoming the diagnosis of the decade. Approximately 3.7 million Americans have fibromyalgia, or 1 in every 73 people. The first line of treatment for these types of pain is often medication, which sometimes may not be the best course of action.
Fibromyalgia is a chronic syndrome of chronic musculoskeletal pain. Patients have pain in muscles, tendons. They perceive to have pain in the joints, but it's actually not involved in the joints, muscles and tendons. Fibromyalgia is triggered by stress involvement, psychological involvement, personal involvement. Different types of bodily injuries can cause it as well. Chronic therapy in the United States is treated with drugs. Drugs is the first line. It starts out with the anti-inflammatories, then it moves on to the narcotics. And that's how pain is treated. People in America, if they have pain, they want a pill to take away the pain.
A certified acupuncturist, Dr. Luxenberg believes general pain should be addressed and remedied without the use of medication. Here at the Pain Management Center at Union Hospital, he uses acupuncture to treat patients who have suffered from chronic pain and fatigue, leaving them feeling healthier than they have in years.
Patients that have chronic pain are on multiple medications. By adding more medications, more side effects develop. Acupuncture is an alternative because it's drug-free. Pain medication is not used. We treat patients via the body treating itself, using needles, using stimulation, and this helps the patient resolve the pain that they're having. The endorphins that I release are similar to the opioids that are prescribed through pain management centers. What I'm looking at for acupuncture patients that we treat is what was life before the pain began. Let's get back to that part of the life that you had before.
Dr. Luxenberg uses acupuncture to treat patients living with lower back pain, neck and arm pain, work-related injuries, cancer pain, arthritis, tendinitis, fibromyalgia, and muscular and facial pain.
A patient is a good candidate for acupuncture when they've exhausted all of the other avenues of pain management. They come to the acupuncture clinic, we talk to them, we take a history, we do a physical examination, then acupuncture is based upon the patient, and we treat the illness. Acupuncture is usually not covered by healthcare providers. I would contact your health insurance company to see whether or not acupuncture is a covered service.
Serving the healthcare needs of Tuscarawas County, Ohio, the Pain Management Center at Union Hospital offers a comprehensive range of services for patients with chronic pain. Its goal is to decrease your level of pain and suffering so you can return to your maximum level of functioning and independence.
And what we do here is we use techniques from very invasive, meaning procedures that involve implantable devices, to acupuncture, where we place needles in people and have endorphins released to decrease their pain response, increase their functional status. And that combined with injections, physical therapy, and often psychological therapy, we can get people back to a functioning lifestyle. And that's really our mission.
I have lived with fibromyalgia for 20 years. You can get 10 hours of sleep in the morning. You feel like you've barely slept at all. Always no energy, tired, and irritable and not sure why. And I've realized I was in so much pain all the time. I started acupuncture with Dr. Luxenberg 6 years ago. And it took about 2-3 weeks, and I really noticed a difference. There are some times after having acupuncture, I will get up and I am totally pain-free. And it's like, it's such a good feeling. And I feel like, I have so much energy, want to do something, but it never lasts. It's not like that's it. With fibromyalgia, it always comes back on you.
There are a multitude of pain ailments that have been treated through the acupuncture clinic and have made the patients functional again. I've had patients with phantom limb pain who've had toes amputated, unable to function. The pain was intolerable. Through acupuncture, once again, they were able to function. Patients able to return to work had shoulder injuries, frozen shoulders, through acupuncture, once again, able to work.
It's hard to have someone really understand how much pain you are in and to recognize it and treat it. It's almost like you feel like you went to other doctors, like they look at you like you just want drugs, and it's like, no, I want to be pain-free. I would recommend acupuncture to someone that has fibromyalgia. It really has improved the pain level. I think people that have fibromyalgia realize you may never be totally pain-free, but the level of pain management that you get can drastically improve your quality of life.
The gratification is they're functioning in society again. They're able to have a daily life, they're able to have a family life, they're able to have a social life, they're able to have a job and hold a job down, which is very gratifying to the patient themselves.
I have Parkinson's, and about a year ago, I was riding a bicycle and I fell off the bicycle and injured my back. Just began seeing Dr. Luxenberg, and already I've seen a big difference. I got up and couldn't believe I didn't have the pain I've had for years. I didn't have it. And I went out and walked my dog. I have 2 dogs I take out every day in the hills. And I just hope it continues. Going to build on this, I just hope it continues.
The effectiveness of acupuncture is that it works. Acupuncture works. You need to give it time to work. You can't give up when you have chronic pain. There is relief out there, and acupuncture is a viable option to give you pain relief.
People living with chronic pain carry a heavy burden, but there is a more effective approach that can help lighten that load. Help restore your quality of life. Contact the Pain Management Center at Union Hospital today. Quality care close to home. To make your appointment, call 330-364-0888 or log on to this website for more information.